Hello everyone, welcome to my channel Daily Drug Info, and don't forget to subscribe Daily Drug Info to watch new videos. Today I will describe what is rabies virus and its treatment. What is rabies? Rabies is a preventable virus disease most often transmitted through the bite of rabid animals. The rabies virus infects the central nervous systems of mammals, ultimately causing disease in the brain and death. Animals that cause rabies are bats, pet animals like cat and dogs, and livestock animals like cattle and horse. How is rabies transmitted? Rabies virus is transmitted through the direct contact, such as through broken skin or mucous membrane in the eye, nose, or mouth, with saliva or brain, nervous system tissue from an infected animal. What are signs and symptoms of rabies? After a rabies exposure, the rabies virus has to travel to the brain before it can cause symptoms. This time between exposure and appearance of the symptoms is the incubation period. It may last for weeks to months. The first symptoms of rabies may be similar to the flu, including weaknesses or discomfort, fever, or headache. There also may be discomfort, prickling, or an itching sensation at the site of bite. These symptoms may last for days. Dengue virus treatment. Drug name: rabies vaccine inactivated. Overview and indications. It is human diploid cell vaccine. Rabies vaccine should be used for primary vaccination and post-exposure prophylaxis of rabies. Doses: adult dose pre-exposure prophylaxis 1 vial intramuscular on day 0, then day 7, then day 21 or 28. Post-exposure prophylaxis doses: 1 vial intramuscular on day 1, then day 3, then day 7, then 14, and day 28. Pediatric doses as for adult. Administration for intramuscular use only. For adult and children, administer into the deltoid muscle. For infants and small children, the anterolateral zone of the thigh may be used. Adverse effects are dizziness, headache, lymphadenopathy, localized malaise, myalgia, pain at the injection site. Thank you for watching Daily Drug Info.